Well, there are many surgical options for bariatric surgery, but we deal with three major options because those are the options that are insurance covered in the state of New Jersey. The first option is adjustable gastric banding. And essentially what that is a piece of plastic which works like a belt around your waist. We insert it through small holes in the abdomen laparoscopically, and we wrap it around the uppermost part of the stomach. And then we cinch it just like we would a belt around someone's waist. It has a buckle, and it stays in place. And we then take the end of that tubing and bring it out of the abdomen and implant a small piece of equipment underneath the skin on the outside so that we can feel it. And after the patient heals from their surgery, we can come back, place a needle into that outside device, and put saline through the tubing of the band to the balloon on the inside of the belt around the stomach. And we can tighten the diameter of that band to the comfort of the patient so that we can reduce the amount of food that they eat, and therefore, in conjunction with exercise, lead to less calories into their system and ultimately weight loss over time. It's a very nice procedure. It's done on a same-day basis, and people have slow and reliable weight loss with it over the course of about a year. The second option is the gastric bypass. That's a procedure that's been done since the mid-1970s. It's been very tried and true, and there have been thousands of patients who have gone through it. It leads to very reliable weight loss. It's very, very effective against diabetes, and people who have significant heart disease will very often choose that because they get very rapid weight loss, very reliable weight loss, and predictable changes in their significant diseases. Diabetes, heart disease, cholesterol issues, sleep apnea, all dramatically are affected very, very quickly. It does require that we cut across the stomach and we make a very small pouch of the upper part of the stomach, basically equivalent to the muscle at the bottom of your thumb in size. So you go from a stomach which is the size of essentially an NFL football to a stomach that size. And we cut the small intestine downstream and reattach it to that small stomach so food comes in, fills that stomach quickly, and then drains into the intestine and meets the digestive juices downstream. People still have the opportunity to digest all their medications and all their food as they need to, but the reduced intake and the metabolic changes associated with moving the intestine around have a profound effect on their metabolic problems. That's typically done laparoscopically, and people are able to get up and walk around 2 hours after surgery, but they will usually stay in the hospital 2 nights. The third option is the gastric sleeve operation. Out of the three, it's the one that's the most recent operation on the scene. And I would have to say at this point, it's the most popular of the three options. There's tremendous interest in this operation because the patients get the benefit of very rapid weight loss and they return to their usual activity very quickly. What it entails is we take a normal stomach, which is shaped like a kidney bean, more or less like this stomach here, and we cut the side of the stomach off and leave a tubular stomach behind. So instead of a kidney bean shaped stomach, you now have a stomach that looks more or less like a banana. And we reduce the volume of the stomach by about 80%. And people lose weight very, very dramatically and very quickly over the course of about a year. They'll lose about 65% of their excess weight. They can eat the foods that they would like to eat, but they eat them in much smaller amounts. Again, they have huge effects on their medical problems, their heart disease, their diabetes, their sleep apnea, and their joint issues. The one added benefit that I see is driving a lot of people towards consideration of the sleeve gastrectomy is that they can continue to take non-steroidal anti-inflammatory medications. Many of my patients have issues with their joints, and they have pain in their back or in their knees or in their hips, and ultimately will go on to have potentially orthopedic surgeries. They can still take those medications that they need to feel better on a day-to-day basis. They don't have to give up their medications which work, and they can get the weight loss at the same time. So it turns out to be a nice opportunity for those people. One of the unique things related to the gastric sleeve is that you can take non-steroidal anti-inflammatory medications after the surgery. It's not recommended that you do that after the gastric band because you have an opportunity to develop ulcers around where the band is with those medications. It's also not recommended after the gastric bypass because the intestine attachment to the stomach can get irritated and you can have something called a marginal ulcer, which under the worst case scenario can cause bleeding or can possibly perforate. You don't have that with the gastric sleeve because you have stomach on stomach and the medication doesn't irritate any attachment. So it goes from the mouth down through the sleeve without irritating things. Thank you for choosing St. Peter's.